Welcome everyone. Our topic today going to be about retrograde pylogram. What is retrograde pylogram? Retrograde pylogram is a urologic procedure that uses X-ray to visualize bladder, ureters, and kidneys. This test uses a contrast media that is injected into the ureters. Contrast media allow the ureters and kidney to be easily seen. This test is similar to IVP, but the contrast media in IVP is injected into the vein, while in retrograde is injected into the ureter. We do this examination to aid in placement of urethral stent, evaluate urethral obstruction, unsuccessful IVP, and to identify stones or tumors. This exam cannot be done when the patient is pregnant, allergic to contrast media, or have a urine infection, and severe dehydration.
Room preparation for this procedure. First, the examination room should be clean and appropriately stocked before the patient is escorted to the room. Then, the appropriate amount and type of contrast media should be ready. Make sure to have the emergency cart full of equipment and medication readily available. Patient preparation and pre-procedure instructions. Patients should fast for a certain period of time prior to the procedure. The patient should void just prior to the examination. Remove any clothing, jewelry, or any objects that may interfere with the procedure. And let the patient wear a hospital gown.
In retrograde, we use these equipment. First one, cystoscope. And the second one, water-soluble contrast iodine. And the dose will be from 3 to 5 milli. Third one, cone tip ended catheter. And the last one, guide wire. Patient position. Patient will be in lithotomy position, which is supine. Knee flexed over adjustable leg support, and the legs are flexed 90 degrees at the hip.
How retrograde pylogram is performed. Patient would lie in lithotomy position with legs supported on a stirrup. Patient would be given general anesthesia. A physician will put a cystoscope through the opening of the urethra and move it into the bladder. Once the cystoscope is in place and the ureteric orifice can be visualized, then the catheter is inserted into the correct ureteric orifice. The catheter contains a guide wire that aids in the insertion. Once in the ureteric orifice, the cystoscope and guide wire are removed. Physician will inject contrast medium through the catheter. Then, series of X-ray film will be taken. When the X-rays are done, the physician will remove the catheter.
We have 3 films that are taken during this procedure. First of all, we have an image called AP Scout. Then we would take another image called AP Pylogram. And lastly, we will take a last image called AP Ureterogram. Center ray and center point used in these procedures are: the center ray is perpendicular, while the center point is to the level of iliac crest. We must make sure that the symphysis pubis is included.
Post-procedure instruction. First, The patient may have pain when urinate and may take a pain reliever for soreness. Second, urine output will be observed closely for volume and signs of blood. Third, once the pain vital signs are stable, patient will be sent home. Fourth, the patient will be taken to the recovery room to be observed. Radiation protection. To protect the technologist, he must wear thyroid shield, lead apron, and lead gloves if possible. For the patient, we will not use a gonad shield, but we may use a thyroid shield.
Radiographic technologist role in fluoroscopy. First, check the patient clinical history. Second, explain the procedure to the patient. Third, preparing and administering contrast media. Fourth, positioning patients to best demonstrate the anatomy of interest.